Okay, so welcome everybody. So this is to talk about breathing beyond basic, exploring the role, scope, and distinction of respiratory therapy. So, like Madam Dorothy said, I would like to one, thank our sponsors, which is Zopec Medical and ARCA for this respiratory series. So, the learning objectives for today is going to be by the end of this presentation, you will be able to one, define respiratory therapy and its role in patient care, differentiate between respiratory therapy and a respiratory physiologist, because I know that there are some parts of the world where, we have respiratory physiologists. Understand the key clinical responsibilities of respiratory therapists, recognize the impact of respiratory therapy on patient outcomes, especially in the critical care setting, and then identify education pathways and career opportunities in respiratory therapy. So, to begin, one of the things we have to first talk about is what is respiratory therapy. So respiratory therapy is a healthcare profession specializing in the treatment and management of respiratory disorders. Now, respiratory therapists work in a variety of settings, in ICU, in emergency rooms, in general ward, in transport teams, and home care. Like in my organization that I work at, we have, Dorothy, can you mute? Thank you. So, in the organization that I work at, which is a 1,000 bed hospital, we actually have.
Please mute yourself if you're in a noisy place. Thank you. And Dr. Benga, maybe you can press F5 to project.
Okay.
Yeah, just press F5.
Okay. So, going back to what is respiratory therapy, so I was talking about in the organization that I work at, it's a 1,000 bed hospital. We have respiratory therapists that work in every way of the hospital, from emergency room to ICU to the neonatal intensive care units to regular patient floors, everywhere. We also do transport. We do both air through helicopter transport as well as ground transport. We go and pick up patients that may have breathing problems, and respiratory therapy is one of the key personnel that actually goes on transport. But talking about respiratory therapy, respiratory therapy is not a new field. There are over 50 countries in the world, and the number continues to increase. Because there is expansion, especially like in the African continent, where we have respiratory therapy professionals now in Egypt, in Ethiopia, in Ghana, and we are currently in the process of actually establishing respiratory therapy in Nigeria as well. So it's not a new field that just started. It's been around from a very, very long time, and the name have changed over time from oxygen therapist to inhalation therapist, and over the years, in 1984, that's when the name respiratory therapist was actually coined. But the profession has been around for a long time, and the countries that actually have respiratory therapists, this is just a handful of them. We have over 50 countries that actually have respiratory therapists. So this is just a collage of just the different things that respiratory therapy does, which we are going to go more in details. That way, we actually go into details in all the different areas. But because I am in California, we are there is a scope of practice that everyone is bound to walk under. So in some countries, every country have a scope that allows the respiratory therapist to function in their different hospitals. Some hospitals will allow respiratory therapists to actually intubate patients. Intubate is when you actually put a tube down a patient's throat. That way, we could actually take over the breathing of the patient. This applies for pediatric patients as well as neonates. The scope of practice goes all the way from hospitals to critical care to actually doing telemedicine, where remote areas of the country where people cannot really get to, we could still reach people on their phones. That way, we could still provide respiratory therapy for them. So, but some of the main areas where you actually will see respiratory therapists work will be in critical care. So this is actually from our simulation lab. We have a simulation lab over here where all the mannequins, they look real. They look like humans, where they could actually talk to you, where you could actually simulate any kind of experience you want the patient to be experiencing. That way, the respiratory therapist could actually train. But in acute setting, most of the time, when respiratory therapists work in the acute setting, you have patients that are very, very critical. Sometimes you have to bypass their own spontaneous breathing and sedate them. That way, that the machine will now breathe for the patient. So the respiratory therapists are the ones that are skilled and trained to work with the machines, and we are actually consulting the doctors are letting us know this is how they want the patient to be, and the patient and the respiratory therapist actually manages the patient from when the patient gets intubated where they cannot breathe, the machine breathes for them, till when they actually get to the point where they're now getting better. And when they get better, we start, the nurses that we work with, they slowly stop turning down the sedation for the patients, where the patient can now start doing more of their own until we actually get them um, off the of the ventilator. Now, with ventilator supports, this is what I'm talking about. When we are at the bedside, we manage patients from when they are fully sedated, where the machine is the one doing all their breathing. The patient is allowed to rest. The respiratory therapies, because of the skills and training that we actually have, we actually take care of the patient's breathing. Now, sometimes there are patients that even though they are breathing, we have to use non-invasive ventilators. It could be CPAP machines, it could be BiPAP machines. And the difference between a BiPAP machine and a CPAP machine, a BiPAP machine has two pressures, which is an inspiratory pressure and a expiratory pressure, but the CPAP only has one pressure. So the people that have sleep apnea, they may use a CPAP machine that just helps to open up their lungs. That way they can continue to breathe while they are asleep. Another key area where respiratory
Red
therapists
one, eh?
work.
Hmm?
Another key area where let's see, where respiratory therapists work is the neonatal intensive care unit.
Man?
I think Dr. Jala, can you mute your phone? Yeah, thank you. So a key area where respiratory therapists work is in the neonatal intensive care unit. Our neonatal intensive care unit at our organization is actually it's considered a level 4, where we actually take care of babies that are 22 weeks old, and we go into the delivery room with the doctors, with the nurses, because the babies are born prematurely. We take him to the neonatal intensive care unit. Either the doctor or the respiratory therapist will intubate the patients. That means they'll put the tube down their throat, and then they'll connect them to the machine, where the machine is the one doing all the breathing for the baby. Now, sometimes the baby may be in the neonatal intensive care unit, sometimes up to 3 months, up to 4 months, until the lungs are fully developed. That way, they can now start breathing by themselves. So that's one of the key areas where respiratory therapists work. The respiratory therapists also work in bronchoscopy lab. So bronchoscopy is when a doctor actually goes down a patient's nose or mouth. They go into the lungs to go and see what's going on. The picture in the bottom is actually our own lab. That is one of our respiratory therapists that actually works in there. And a doctor could go into a patient's lung for several reasons. They could either, look because there may be the patient may be coughing. They may take the patient's X-ray. After they take the X-ray, they see some things that doesn't look like it needs to be there. They will use a scope, which is a long tube, which could either go into the nose or the mouth. They'll go into the lungs and they'll see what's going on. Sometimes, this could be used to help diagnose. That we actually have different things that could go down the scope. That if there's a foreign material that's in the lungs, we could actually use we either have what's called a retrieval basket. It's a long wire that you could actually put down into the scope, that you can now use it to pull whatever is down in the lungs out. It could be a mucus plug. It could be anything that you could think of. We could actually use a bronchoscope to actually go down into the patient's lungs to actually see what's going on. So I know that some of these things may be a little bit high level, but I want to switch over now to respiratory physiology, where respiratory therapists actually also works in they perform the role of a respiratory physiologist. We actually have a lab over here as well, where we actually we test patients from ages as low as 5 years old, if they could follow instructions. We've actually had as low as 4 years old that could follow instructions, all the way to 65, 70-year-old patients. And when they actually do this test, this is how we can actually diagnose patients. If the patient has either a restrictive defect, because of the way their spine are, the spine is causing their lungs not to fully expand, or it could be an obstructive defect, which could be either COPD, asthma, or whatever you could actually think of. But a respiratory physiologist, they could work in a pulmonary function lab. They could do exercise testing. You guys may have seen commercials like for athletes that may be on bicycles. They have something on their head where they ride in a bike. They are doing a stress test. We do that in our lab as well. We actually have sleep studies. Physiologists work in sleep lab, where they actually are monitoring the patients as they sleep. And when they sleep, we're looking at, are they really do they stop breathing, to try to see what kind of apnea they actually have. And they actually have in a respiratory physiologist also help to assess patients' lung volumes and diffusion capacities. Now, in a physiology lab, which we actually call a pulmonary function lab, in the United States. A patient is connected to a machine. In the machine, inside of the machine is a box, and the box has a known volume, and you could actually see, you can measure all the volume in the patient's lung. So that's how you could diagnose if the patient has an obstructive defect. We could include asthma, it could be chronic obstructive lung disease, it could be emphysema, or it could be any kind of restrictive disease, which could be like a sclerosis. Now, what I just explained, this is what it looks like. So you actually have a patient that is in the box and they are breathing, and the physiologist is explaining different maneuvers that the patient has to do. Most of the time, for you to get um, good results from the patient, you may need to demonstrate what the patient is going to do, and the patient now does it. That way you could actually get the best effort from the patient. Another thing that uh, respiratory physiologists do, which respiratory therapists also do, is actually to do blood samples. We call it blood gases, and what we do is in the blood, you run the blood through a machine, and the machine will now look at all the different elements that's in that blood. It will give you your acid base status, which is going to be measured in your pH. A regular pH is between 735 to 745. If it is on the low end, it will say that the patient has a lot of acid in the body, and it may be because they're not breathing appropriately. They slow down their breathing because maybe they're on some kind of drugs. There may be something going on in their brain that's not allowing them to breathe. Or on the other end, if they are hyperventilating, where you're going to have a pH that's going to be a little bit higher. And when you actually have that, you're going to have your CO2 in your blood will be lower. So the things that you're going to measure when you draw a patient's blood, you're going to look at the patient's oxygen level, which is referred to as your PaO2, your partial pressure of your arterial oxygen, your PaCO2. You're going to look at your pH, which is an acid-base pH. You're going to look at your bicarb, and your bicarb is the metabolic side that actually make sure that the respiratory side is compensated. That way your acid base status is okay. And then you have a base excess. Your base excess, your normal base excess is plus or minus 2. And if there's anything going on in the body, the metabolic part of the body, it takes a long time to actually start compensating. So that's how you can know if it's an acute or chronic defect. So going to the differences between respiratory therapy and respiratory physiology. So when you look at the primary role of a respiratory therapist, the primary role is going to be in the direct patient care. That means that they're going to be working in an acute facility. They're going to be supporting a patient's life. So that's why it's called life support. If a patient stops breathing, we may need to help to push on the heart to help get the heart going, and someone may be using their mouth to help blow air into the patient's lung, even though that is not recommended. Now you want to use a mask, and then you use a resuscitation bag, and as someone is pushing on the chest, someone is breathing for the patient. On the other end, for a respiratory physiologist, they are mostly going to be in a diagnostic testing lab where they actually are performing pulmonary function assessments. They're doing research. At our hospital as well, we do a lot of things. We also do research. We do research on drugs. We do research on a lot of things, which respiratory therapist is also involved in. The work settings, like I said, working in the ICU, working in the emergency room for a respiratory therapist, working in the general ward care for patients that are not really that acute to be in the ICU, where they may need breathing treatments, they may need any other other drugs like a steroid to help to relax the lungs. That way they can start breathing better. They could be part of the transport team. It could be in an ambulance. It could be in a helicopter. It could be in a fixed wing airplane. A respiratory therapist can work in any of those areas. Even in the home setting, we actually have patients that we actually send home, and a respiratory therapist will follow the patients to make sure that one, they do any education for the patients, how they use their drugs, how they if they have a peak flow meter, how they use it. Um, Dunville, can you please mute your phone, mute your computer? Yes. So, for a respiratory physiologist, they mostly work in a pulmonary function lab, a research lab, or an outpatient clinic. The patients are not that serious, they're not that ill compared to a respiratory therapist where they are working in a hospital setting. Now, their core responsibilities, their key responsibilities, if a patient stops breathing, a respiratory therapist is what you need, because they will take over your breathing. They will help you to breathe. That's why when they put a tube down the patient's lung, they will help the patient to breathe. If the patient's heart stops, they will help to push on their hearts to get the heart going again. Um, a respiratory physiologist, some of their core responsibilities include doing lung function assessments, doing exercise testing, also doing sleep studies. Patient interaction for respiratory therapist. Let me just mute. Okay, for patient interaction, the interaction within a respiratory therapist is high, because if a baby is born, a respiratory therapist have to be there because it's an emergency. If it's even if it's a regular well baby, over here we actually have respiratory therapists that actually goes as well, because if the mom received any kind of medicine that may decrease or stop the baby from breathing, the respiratory therapist and the doctors will be the one that's going to have to try to help revive the baby. That way the baby can start breathing again. For respiratory physiologist, it is not really as high as respiratory therapist. It's considered moderate because they typically help in a lab. They help to schedule patients. The patients are not really that critical. After testing in the physiology lab, the patients usually go home. Most of the time, when a respiratory therapist is working on a patient, it may be on the acute side where something really bad happens. The patient is in the emergency room, the patient is in the ICU. The patient doesn't really go home right away until the patient actually gets better, and the respiratory therapist continues to follow the patient. The education and training. The education for the respiratory therapist is clinical. It's clinically focused. You have to go to a program that actually offers respiratory therapy, and the curriculum for respiratory therapy includes making sure that the clinician has experience in physiology, in anatomy, in biology, in physics, because when you start looking at all the gas exchange, even math, you have to actually know that. For education for a respiratory physiologist, it's more science focused. You're looking at more physiology, and a lot of the work is done in the lab. So, when you start looking at the importance of respiratory therapists in patient safety, you know, a respiratory therapist, they help to make sure that the patients that are, they're breathing the way they're supposed to be breathing. Because you actually are putting a tube down the patient's throat, that means that you could actually also introduce bacteria into the lungs. So that's where good hand hygiene comes in. When we are caring for patients, we want to make sure that one, we wash our hands, and then we put a glove on. And if our gloves are soiled, we want to make sure we take it off and put a clean one on. Respiratory therapists, they play a critical role in emergency airway management. If a patient is critical and the patient stops breathing, in some countries, in some states, here in the U.S. as well, the respiratory therapist will be the one that's going to put the tube down. And when you put the tube down, you want to make sure that you're using a sterile technique where the tube that you're going to use is clean. You want to make sure that you check the balloon next to the tube. That way, if there's a cut in the balloon, you don't want to use it. You want to make sure that you minimize the number of time you go into the patient's lungs, because as you're going into the lungs, you could introduce bacteria. You could even injure the lungs by using the wrong equipment. Now, respiratory therapists, we don't walk alone. We walk with physiologists, we walk with nurses, we walk with doctors. In the place where I work at, they actually, they depend on respiratory therapists a lot. Where some doctors will just say that, what, just go ahead and do what you have to do, and they'll write all the orders for it. That's the trust that they actually have in respiratory therapists. And when you start thinking about COVID-19, COVID was something that yeah, COVID was something that we had, several years ago. It was a pandemic that affected not only the U.S. but countries all over the world. Respiratory therapists were some of the key essential workers, where when they actually some places people couldn't really go to work, but respiratory therapists, they had to go to work, because a lot of these patients, they were very, very critical. Some places actually had to bypass. That means the machine was the one breathing for the patient. So the respiratory therapist was the one managing the machine to make sure that the patient could still stay alive. So those are some of the key things that respiratory therapy does, and why it's actually very, very important that respiratory therapy continues to keep up on all these skills. Now, when you look at educational opportunities for respiratory therapists, there are several pathways to become a respiratory therapist. At least in the U.S., there's an associate degree, which is, it's a 2-year school that people could actually go to. There's also 4-year degrees where people could actually go to school for 4 years and become a respiratory therapist. At the hospital that I work at, we also have a university where we actually have a bachelor's degree respiratory therapy program, where I'm also one of the instructors in the program, and I do both adult critical care and neonatal education at a school. But respiratory therapists, when they are, regardless of whatever school they went to, a 2-year school or 4-year school, you have to actually be credentialed. You have to have a credential that shows that, yes, you are now a registered respiratory therapist. There are some advanced roles that are coming up now, which is advanced practice respiratory therapist, where the respiratory therapist function as a physician assistant. They function under the license of a doctor. Or you actually have respiratory therapists who are educators in different schools. Some respiratory therapists that actually take leadership roles, they actually end up becoming managers. They become directors. They run hospitals because of the advanced roles that they actually have. And regardless of whatever role or path that someone takes, there's always opportunities to collaborate with a physiologist. In the US, we don't really have that much physiologists, because that role is done by a respiratory therapist, because the training that we receive, it just depends on the subspecialty that you actually want to go into. Now, for career path for physiologists, a physiologist, a respiratory physiologist, it's a 4-year program where you can either go to school for 4 years or you could take an additional year, which is a 5th year to now get your master's in physiology. Or it could be in a clinical science. In the US, we have certifications for people that only perform pulmonary diagnosis, like in the pulmonary function lab. They could either be certified, pulmonary function technologist, or they could be registered pulmonary function technologist. And a respiratory physiologist, if they want to actually advance, they could either be in a teaching role, or they could actually be in research where they help conduct clinical research. So to conclude, this is actually, some of my team members. We actually have a lab where we actually train. When we hire people, we also have students that actually come here. We actually have people train, and this is how we continue to make sure that we keep the skills up for our team. But to conclude, respiratory therapists and respiratory physiologists, they play a key role in in the way that we take care of the patient's lungs. The lungs, even though we have people that doctors that specialize in the lungs and that they're called pulmonologists, but respiratory therapists, even though we are not doctors, but we are also our expertise is in the way we actually work with the lungs. you know, um, you know, Respiratory therapists focus on the clinical intervention and mechanical ventilation management, while physiologists they specialize in the diagnosis and assessment of patients as well as research. Both professions they contribute to the way to improving patients' life, because for patients that may have breathing problems from a physiology perspective, if they go to a lab and they actually get tested, they can actually know what are some of the things that may be going on in the patient's lungs. Do they need any kind of medicine to keep their lungs open? We have a lot of people in third world countries, Nigeria, that have breathing problems, where they don't really know that yes, their lungs are getting tight, and there are medicines that they could actually give to those kind of patients that's going to open up their lungs. Open up their lungs. For anyone that's interested in a career, like I said, I'm speaking now in particular for Nigeria. We I have been going to Nigeria to make sure that one we introduce this to the country. There have been a lot of walks that have been going on trying to get respiratory therapy implemented. Um, we have had several meetings with some key people, respiratory physiology students that are interested in becoming respiratory therapists. So we actually have a small group. I want to say about 20 people now, and that's going to continue to grow. Hopefully, we will have our own, association very, very soon, which is now going to be, hopefully, is going to be the Nigerian Association for Respiratory Care. And that way we will continue to promote respiratory profession in Nigeria. And to conclude, I know that Dorothy had mentioned that yes, I work in a hospital in California. These are part of my some of my team members. I actually have a total of about 220 respiratory therapist doctors that actually work under that report to me. Because we do research, we have a school, and some of my staff members they're actually educators as well. They teach in a school. So we do have time now for questions. Now, for the questions, I am going to stop sharing now. For the questions, if we don't actually get to all the questions, we will make sure that I will respond to everyone's email. I'll put in an email and I'll send it to everyone that have registered for this webinar. But Dorothy, if you could actually um, for some of the questions that may be in the chat, can you please, if you could just summarize some of the themes, that way we could start asking, I could provide some feedback to some of the questions.
Okay, so the first question for today is, I'm a physiology. Can I become an RT? Do I have to change my profession? Or do I have
So, that's a very, very good question. So I don't really know for any other country. But for Nigeria, one of the things that we are working on is we have a lot of people that have background in respiratory physiology. Um, I'm actually going to Nigeria in a month and a half, and it's more to actually have conversations with some key stakeholders from the Ministry of Education and Ministry of Health to see how we could actually have some of this respiratory physiologists that may be interested in learning respiratory therapy because they have the foundation of physiology and some of the classes that someone who is going to respiratory therapy needs to have. We may just need to focus more on the respiratory function, how they actually set up oxygen, what kind of devices we could actually use for oxygen. um, uh, University of Lagos. I've actually, had conversations with the University of Lagos, and they actually are looking to actually start a program similar to this. So there are more to come. I don't really think that someone who is a physiologist now in Nigeria, the way we are trying to make sure that the curriculum is they won't have to go back to they'll have to go back to school to do some of the respiratory classes, but they don't have to take their whole classes all over again.
Thank you. So the next question is, the person say here in Liberia, respiratory therapists are not allowed to give injectables. Is this a worldwide healthcare policy, or it's only my country?
So when you say injectables, like, are you talking about
I think the person means
injections?
injection. Yeah,
So,
injections.
the respiratory therapist in the US, as far as I know, and I could speak more about California, um, there are some injections that is actually in the scope of practice that they can actually give, which is only vaccinations. But when it comes to other drugs, now, when you take advanced cardiac life support, even though there are some drugs that we are exposed to, but most of the time there's also a nurse that is part of that team, and the nurse will be the one administering all the injections. So in the US, for California in specific, the respiratory therapists do not give injections. But if the injection is a vaccine, it's in our scope of practice to actually give some vaccines.
Okay, so the next question is, please, how can a registered cardiothoracic nurse navigate through being a respiratory therapist in Nigeria?
So, that is one of the things that we need to discuss, because we do know that currently there are some nurses that are the ones that are managing ventilators in intensive care units in Nigeria, and some doctors as well. We'll need to see, based on the interest of the nurse, how they could actually attend some additional training. That way they could actually get the expertise. But most of the time, you know the target audience for to be a respiratory therapist is going to be physiologists, because their background is very, very similar. Now, nurses also do take similar classes, that respiratory therapy does. But at least for the U.S. Um, respiratory the respiratory function may be just be a class that they spend maybe 1 or 2 hours on, and then they go to something else. But in the US, you actually have people that actually go to school and study the lungs and the heart for 2 to 6 years, and that's how they become expertise. So for a nurse that wants to be able to function as a respiratory therapist, there are going to be some additional classes that they need to take for them to be up to speed, to be able to do all the things that a respiratory therapist does.
Okay, so the next question is, what is the most appropriate way to showcase yourself, especially among clinicians who thinks RTs are not that relevant?
So, that's a very, very good question, because I have worked, I have been a respiratory therapist for over 30 years, and there are some places that do not really respect respiratory therapists. One is having, advanced education. Knowing that yes, with your advanced education, you can now recommend different things that the team may not really know. Over here at my organization, like I said, I have over 220 people that actually are under my team. They are all well respected. When we actually go into the emergency room, they just say, "Oh, the respiratory therapist is here," and the doctors have confidence that we know exactly what to do, and they go and see all the patients that they have to come to at some point, but they depend and they respect the respiratory therapist based on our knowledge and the expertise that we bring to the table. So it's not going to be something that's going to be overnight. It's going to be, having a medical director as well that's an advocate for respiratory therapists. And even though sometimes, respiratory therapists may think that, oh well, we need to take additional things on, but that's actually how we actually gain respect. Because we have respiratory therapists that actually run ECMOs now, which is extracorporeal membrane oxygenation, where where you bypass the patient's heart and the machine is the one doing the oxygenation for the patient, and then you actually put the blood back into the patient's body. We have RTs that are doing that. We have RTs that are putting arterial lines. Some of the functions that nurses are doing. So I think it's going to be something that one, I'll say, work with your medical director and the people that you report to, and let them know that yes, RT is just more than just doing breathing treatment, because my team over here, we do way more beyond that. So it just depends on the scope of practice as well, that the state, if the RTs in the US, the scope of practice that they are allowed to do.
Okay, someone is asking, how does a respiratory therapist differ from nursing?
So there's a big difference in respiratory therapy and nursing. One, the education level. Yes, nurses go to school and they have to know the patients from head to toe, but respiratory therapists, they specialize in the lungs and the heart. I have gone to nursing programs where I know that there's, in, they talk about, respiratory lungs and the heart, and it may be 1 or 2 hours that they actually gone over the cardiopulmonary system. But respiratory therapists, we actually specialize in the lungs, where from your chemistry you have to know about how all the different chemicals, how they mix in the body. From your physiology, you start looking at your diffuse. From your physics, you start looking at physics. I'm sorry, you start looking at osmosis. How things go from one to another. You start looking at diffusion. When air gets into your lungs, how does the air goes through from the lungs to your blood, and how does the oxygen in your lungs get to the blood, and then how does the carbon dioxide in your blood gets back to the lungs. That way you can exhale out. So there's huge difference in nursing and respiratory therapy. There are some nurses that end up specializing in cardiopulmonary, and that's just because they have taken additional classes. That way they better understand the role of the cardiopulmonary system. But yes, there's a big difference. Respiratory therapists, we learn, 2 to 6 years. We learn and master the cardiopulmonary system, where a nurse have to know exactly from head to toe what's going on with the patient, which is a big difference.
Someone is asking, please, can you tell me about bubble CPAP and what's the difference between mechanics of the breathing between an adult and pediatric patients?
Okay, that's a very, very good question. So when you look at the anatomy of a neonate, which is someone who may be born, a regular baby actually grows in a mom's womb for 40 weeks. If the baby, there are studies now that says that the baby could be 36 weeks or higher for them to be viable. That means that their lungs have matured to be able to breathe by themselves. Any baby that is born less than 36 weeks, they're considered premature. So in an adult, there's something that we have in the lungs called surfactant. Surfactant keeps our lungs open. In the neonate, because of the prematurity of based on the age of the baby, they may not really have surfactant in the lungs. So sometimes when we have a premature baby, we have to inject surfactant into the lungs to make sure that the compliant, when you are now breathing for the patient, that the lungs actually stay open. So when you now talk about bubble CPAP, the lungs actually have, when you actually breathe now, the lungs doesn't really collapse all the way down. So there's what we call a positive end expiratory pressure that actually keeps the lung open, which is called PEEP. Now, in neonates, sometimes you don't, because the lungs are not fully developed. So when you give surfactant, you still need to have the lung stay open because you don't want it to collapse. So a good way to actually do that is to give PEEP. So, and you could either use a machine to give PEEP, or you could do a less invasive way where you actually have the easiest way to picture it is to actually have a jar, and you actually have more like a tube that actually goes into the jar, and the jar has water in it, and that's how you actually create PEEP. So, and that PEEP helps to keep the kids' lungs open. Everyone has a physiologic PEEP, which is about 5. So, and that is amount of pressure that actually keeps the lungs open. So the anatomy of a neonate is different from an adult, where the adult is matured and they can keep their lungs open by themselves. But for a neonate, the lungs are not fully matured, where you need to get some PEEP in there, and bubble CPAP is actually how you provide that PEEP to a neonate.
Okay, thank you. So the next question, what is the pathway for registered critical nurse to become RT in Ghana?
So I'll probably have to
I
lean
think I'll
to
take I'll
yeah,
take that
yeah,
answer. Okay,
yes,
so
please.
for Ghana, we have the bachelor's degree respiratory therapy program. Okay, so if you are a critical care nurse, you would have to go through the University of Ghana application system. I mean, for you to become a bachelor's degree student. I mean, to go through all the registrations that you have to do. And we also have the head of department for respiratory therapy. She's connected to the this webinar. If you have any concerns, you can go to the University of Ghana Department of Respiratory Therapy. It's located in Kolebu. So when you go to Kolebu and you go to the department and you can make all the necessary inquiries. She'll review your transcripts from your previous course, and then she can advise appropriately. And then the next question is, can you differentiate from cardiopulmonary physical therapist? I think the person wants to find out cardiopulmonary physical therapist and respiratory therapist.
Okay, so and I'll try my best to answer that question. So when you start looking at physical therapists, you actually looking at the functions of the way all the different muscles actually work on the body. So, you're looking at, if you're looking at the muscles of your chests, your diaphragm, how they all connect together to make sure that you can still take a deep breath in and blow out. So that is a physical therapist that actually specializes in the respiratory system. That way the patient could actually breathe better. Now, when you start looking at the functions of a respiratory therapist, it's different from a cardiorespiratory physical therapist, because the cardio physical therapist, they don't really know all the different details when it comes to your gas exchange, when you take a deep breath in and it goes into your lungs, and then the air have to now move from your lungs through your blood system through a process called diffusion. you know and then you have your oxygen that is in your lungs that actually has to go into your blood, and then you have your carbon dioxide that's in your blood that has to go back into your lungs. That way you can exhale out. They don't really go into all those details, but the physical therapists are more concerned about the muscles of your body and how does that really affect the way you actually breathe. Now, we do have some physical therapists. There are some neuromuscular diseases. A good one is myasthenia gravis, where it's a disease that actually affects a person that starts from the top all the way down to the bottom of the patient's legs, where the patient starts losing function. In those kind of patients, you want to make sure that you're doing some tests to make sure that you check the functionality of the muscles, because of the disease. If the muscles start getting affected, you want to make sure that you also you want to start intervene. And the two main one is myasthenia gravis and um, there's Guillain-Barré, and that one actually starts from the ground and goes all the way uh, um, uh, to the top. So there are different disease processes. You still have to make sure that you actually continue to test the patient by making sure that you do some breathing exercises that doesn't affect the main muscle of for breathing, which is your diaphragm. Because when it start affecting that, you know that your patient is going to be affected, and you may now need to start looking at how you're going to support the patient while the patient goes through that crisis.
Okay. So to add to what I was saying, so that that particular question may not be repeated, please, if you are interested in pursuing the bachelor's degree program, respiratory therapy program, in Ghana, just as I said, you go to the University of Ghana website. It is published over there. And then, as I said, the department is located in Kolebu. So when you get to Kolebu, you ask for the Department of Respiratory Therapy, and you would meet the head of department. She can advise you properly on what your particulars are and what you can do next. So that is the answer to that question. I have repeated it again. So the next question is, can you differentiate from cardio? Okay, so we've done that. Another question from Liberia says, if respiratory therapists carry on such critical and vital role in healthcare settings, why can't they give injections? Don't you think there is the need to revisit or amend our scope of practice? So this is the question from Liberia.
So it depends on the scope of practice that's agreed upon in that country. If the country feels like yes, um, administering injection should be part of the scope of practice for the respiratory therapist. What I will advise is maybe meet with your Department of Health Services, or there have to be a way to be able to change or make recommendations to your licensing board that is something that they need to add to the scope of practice of a respiratory therapist. That way they can administer injections. So the reason why I'm saying injections is because now when you give injections, if it's going to be cardiac medicines, that's going to affect the heart, you know, that may be outside of the scope of practice for a respiratory therapist, where a nurse may be the one that's going to be able to administer this medication. Because once you administer the medication, is the medicine you're given, is it going to slow down the heart, or is it going to make the heart work much, much faster? And if you give that medicine, what other part of the body is it going to affect? You know, um, um, by you giving that medicine. So I will say, I'll recommend that you lobby your licensing in Liberia, and if that is very, very important, I'll just say, that should be added to the scope of practice for the respiratory therapist in Liberia.
Yes. And also for Liberia, this is where you have to liaise with your Allied Health Professions Council, for them to go through your scope of practice and they can advise properly. And then your faculties are also there to also guide you. Thank you very much. Okay, another question is, I think this person is trying to say how should the RT be known or become, the awareness of respiratory therapists. Yeah, how can we make them aware or make people aware of the profession in that sense?
So that's a very good question, and I think that's where ARCA comes in. We are trying to make sure that there's representation from all the different countries in Africa, uh, providing webinars like this, where we are going to be talking about different topics. This is just the first one. There's a lot of webinars that are planned that will be able to provide information to people. But in the country, uh, and I'll speak for Nigeria because that is what I know best. Respiratory, there's really not a lot of awareness of respiratory therapists. So there are different people that may be in the diaspora that would like to have respiratory therapy be known, and maybe different peoples that doing different things to be able to bring respiratory therapy to the forefront. That way, everybody knows about respiratory therapy. But that's why meeting with people in your government, the Ministry of Health and the Ministry of Education, it provides that awareness. Also, churches, we have a lot of people that actually go to churches, having education sessions, at church, using that church platform to be able to create awareness of not only the disease but also the profession. Because a lot of people know about and I'll use an example: wheeze or asthma. People may know that, hey, you know what, my son, it's hard for my son or daughter to breathe. They may not really know it is asthma, but they just know that they hear a sound. The sound is more like a high pitch, and which is called wheezing. So, you know, having the awareness and bringing that information to people that may not really have access to hospitals close to them, they know exactly some first aid that they can actually do to provide those kind of information to people. That is how we bring awareness about respiratory therapy to the country. Because yes, there are some, in all the countries in Africa, you have the big cities, but there are also some remote areas where we need to get this information to as well. That's why with the age of our technology, with the smartphones, we have some people that are actually using their phone now to attend this webinar. We should be able to deliver information to people in remote areas using their phones, but we have to get the awareness of, yes, there's going to be, webinars similar to this that is going to be available. You don't really have to be in the medical field for some of the topics that's going to be talked about, for you to understand and bring those information, not only to your family members, to parents, or even to your children, because once we get that information out, we could actually pass that information out to a lot of people.
Okay, thank you. The next question is, this is coming from a medical sonographer. It
Okay.
says, what is the place of medical imaging in respiratory care? And as a medical sonographer or radiographer, what are some career areas I can venture into in respiratory therapy? Is there a way to marry both fields, which means medical imaging and respiratory therapy, for more research work?
So, for someone who is in medical imaging, I think that research will be one of the areas where they may want to focus on, unless you work in a organization or hospital where there's a lot of imaging that gets done. Um, if there's going to be imaging that's going to be done on the lungs in particular, they're going to be using more MRI or CT scan to be able to look at different parts of the lungs, all the way down to the different alveolar sacs, where if you need to get to the granular level. If as a sonographer, where you actually are using a Doppler to actually look at the patient's heart. We do that over here more for patient if you need to do a arterial puncture and the patient is a heart stick and you're trying to find out where's the patient's artery. You could actually use something like that. But for someone who's a sonographer, I'll say, look and research, especially when you start looking at some pharmaceutical companies that are into a lot of research on drugs. That is where I'll recommend.
Okay, thank you very much. And then a question is coming from a student in a final year, but it wasn't so specific. It says, I'm in a final year. How can I develop and improve my academic and professional level? Okay. So it
So
wasn't specific whether they are respiratory therapy students or med lab students. They didn't specify, but how can they improve their academic and professional level?
Well, that's a very good question. To improve the academic level, I think, simulation. I know that, simulation is not really big in African continent yet, but there are some places where they actually are using simulation. In simulation, you could actually try to come up with different scenarios where you will, you could say, okay, the patient comes in, they have an asthma attack. How will you treat the patient? So you in a lab where you actually have mannequins, you could actually mimic a patient coming in where they're breathing spontaneously, they're not in any kind of distress, and then you start manipulating the computers where the mannequin can now start having respiratory distress, either by having shortness of breath, by having wheezing, or the patient may have stridor. And then, because that is a controlled environment, you could now think about, if in this scenario, how will you help the patient? You could make mistakes because it's just in the lab, but it's in the lab that you get better and you own that skill. So that way, when you actually are in an actual setting where you are dealing with patients, once you're exposed to those kind of scenarios, you can now provide the information that you've already learned from the simulation to now actual patients. So I'll say simulation.
So simulation is the best way. Thank you very much.
Well, I'm not going to say it's the best way. It's one of the ways,
One of the ways. Okay.
correct.
Yeah, to improve upon academic performance. Okay, that's good. Please, the question on mechanical ventilation and pressure support, it will be in our next segment. I want us to, focus on the topic for today. So the next question afterwards is, I'm an IT graduate. I'm an IT graduate. Can I
Information technology.
Yes. Can I
Okay.
do respiratory in Ghana? I think I will want to take this answer. I would want to answer it. Um, you would have to have had background in physics, chemistry, biology, and elective maths, which means pure science background. So if you want to do respiratory therapy, meaning you have to improve on your basics. Okay, you have to do those basics because those fundamentals are what is going to build those blocks for you to develop in the program. So if you have an IT background, you would have to go back to school to start from the basics, and then you can pursue the respiratory therapy program in Ghana. Thank you very much. And then we have
And I,
another.
I just
Okay,
want to add to that,
ahead.
because the classes for IT, um, it's not, they're not really science based. So the science based classes, which are, anatomy and physiology, because you have to know the body and how the body works. You have to have your biology, your physics, and your chemistry and your biology. Now, for IT, maybe you've taken some math. You would need to take some math because you need to know how the different equations, that you need to know, to be able to, care for your patients. So, the foundation that IT has provided doesn't really meet the standards for respiratory therapy. So, for someone that wants to cross over from IT to RT, respiratory therapy, they may need to take additional classes that's going to give them the background and the foundation to be a good clinician.
Yes. Thank you very much. And another one says, can a pharmacist become a respiratory therapist? How
Well,
does one get certified? Yeah.
so I think a pharmacist, it's a higher education, as compared to a respiratory therapist. So I think that where a pharmacist could help support respiratory therapy is because they have the knowledge of the drugs. Not only do they know, they have knowledge of the respiratory drugs and how it affects the body, but the other drugs that the nurses may be using that also affects the body. So, you know, um, having a pharmacist that wants to become a respiratory therapist, I think you just be a highly educated respiratory therapist, because there's really nothing that says that you cannot really do respiratory therapy. But it seems like a step backwards if you are a pharmacist, um, and now want to go to school for respiratory therapy.
Okay. How can a nurse in Liberia consider this profession and expand? So meaning how can a nurse in Liberia become a respiratory therapist?
So, if there are respiratory programs, in Liberia, what I will recommend or suggest is, one, looking at their transcript and seeing what are some of the classes that they took as a nurse, that someone that may be in respiratory therapy school also need to take. So if they've actually looked at those, if they look at the transcript and said, okay, well, I've taken my anatomy, my physiology, my English, my math, then they don't really need to take that. Then they need to maybe concentrate on the core classes that give you the knowledge to become a respiratory therapist. So there are some similarities in from nursing and respiratory therapy, but there are also differences in the sense that the classes that you need to become a therapist, you may need to take that, but you probably finish sooner because you've actually taken some of the prerequisites that someone that's in a respiratory therapy program need to take.
Okay. What is the difference between PEEP and mechanical? Okay, so any questions pertaining to PEEP, mechanical ventilation, and all that will be addressed in the next webinar session. Okay, so we want to do the education for today. So please, your question is well noted, but we would keep this question and then present it when that topic is being presented. Thank you very much. How long will it take for a person with BSc in
In
biology
physiology,
in
biology.
biology to complete a study in RT?
So I think it depends on the country the person is from. It has not really been finalized yet in Nigeria because, when I have approached the University of Lagos, what they had said that they had a lot of people that have graduated with their BS in physiology that are interested in becoming respiratory therapists. With that being said, it may take an additional 2 years for someone that has a BS in physiology or biology to be able to learn the key respiratory function, and then to also have the clinical expertise to be able to get hands-on experience at a hospital to be able to become a good respiratory therapist.
Okay. So in Ghana, just like I said earlier on, if you have any questions or any concerns, especially with your background, and you want to pursue respiratory therapy, you go to the respiratory therapy department and you request, or you make at least you make an appointment at least, so that the head of department will know that you would want to have a discussion about your intention to pursue respiratory therapy. So the department is located in Kolebu. So when you get to Kolebu and you're not finding your way, you get to the School of Biomedical and Allied Health Sciences Administration, and you'll be directed accordingly. The head of department over there is ready to answer all your questions and would advise appropriately. Thank you very much. The next question is, can we do commercials during prime time to enlighten Nigerians? So this is all about advocacy in Nigeria.
To do
Like,
commercials.
yeah, asking, this person is trying to say that for people to gain awareness or for publicity about the profession.
Yes. So, and I think that's where the government comes in, because we have actually looked at this option to try to create awareness. And you know that sometimes for you to try to create awareness, regardless of whatever country you are, there's going to be some added cost to it. So for at least for Nigeria, when we've actually tried to get this published in the, we actually had a company that were trying to sort of try to help with all this marketing and awareness of respiratory therapy. There was going to be a cost to it, so that's why we are going to take the high road and trying to see how we can actually reach out to the ministries, the Ministry of Education and the Ministry of Health, because if they understand what respiratory therapy is, if they understand the value of what a respiratory therapist brings to the organization, they will make the public service announcements to be able to help market respiratory therapy to the country, and that's the strategy that we are looking at.
Okay, so I'll read the last two questions and then we can end the Q&A segment. Okay, any other question, we would answer it. Since you sent your email during the application or the registration process, we would answer you over there. Okay, so is there how can the organization, meaning how can ARCA help other countries that do not have respiratory therapy program?
So this will be a question that I also like Dorothy to also answer, but
Okay,
I will start.
okay.
For a country that doesn't really have respiratory therapy, there have to be someone who is passionate about respiratory health. um, either someone that may be in the diaspora that's a respiratory therapist and sees that yes, there's a gap in their country, and the gap is respiratory therapy, and how can we make sure that we bring respiratory therapy to that country. So that person could be, ARCA is a volunteer organization. They could try to partner with ARCA, where we could try to identify a country director that could help. There are a lot of countries now that are reaching out to ARCA that wants to know more about ARCA, and from there, maybe we can now begin to gain awareness of what respiratory therapy is. Also, this webinar is a way to get information to people all over the country, all over the world, to know exactly what respiratory therapy is. Now, you'll see that there's not a lot of you know uh, people. The people on this webinar today that are in the U.S., they may be from another country, and they're trying to see how they can actually bring respiratory therapy to their own country. But what we could do is, if they know of someone or they want to identify themselves and trying to be a country director, that way we could try to leverage the expertise of ARCA to try to bring awareness of respiratory therapy. That way we could get something going in that country. Dorothy?
Okay, so also we are involved in stakeholder engagement. So when we get a country representative that is so passionate, just as he said, so passionate about enhancing respiratory therapy in your country, what we do is, as an organization, is to engage this person with their stakeholders. Their key stakeholders can be their regulatory body, their Ministry of Health, Ministry of Education, and whoever is in policy making to help champion that cause of establishing respiratory therapy in that country. So this platform is actually going to give us more insight and would attract these key stakeholders for the rest of the African countries that do not have respiratory therapy. And also, because countries like Ghana, Egypt, Ethiopia, and Liberia have started respiratory therapy, this platform will be an avenue for you to know what is going on in other countries that have the program, so that you can follow the same pattern. So that is what we can say. On this note, I would want to end the Q&A session over here. If you have any question, kindly forward your questions to questions@africaresp.org. I'm going to type it in the chat box so that you can send all the questions that you have over the africaresp.org. So thank you, Dr. Agbolemosi, for your presentation. We are so impressed about the information you have given us. I hope you have all been enlightened about the profession. And parents that are here, non-medical practitioners that are here, this is the best opportunity to spread the news, spread the profession, make it popular in your country, because Africa needs respiratory therapies. We have to tell our own stories. We have to manage our own people. And just like I said earlier on, this webinar series is going to continue throughout the year. Every 2 weeks, we are going to have different health practitioners coming on board. It can be pulmonologists, it can be speech pathologists, it can be audiologists, it can be occupational therapists, nurses, all health practitioners could present on this platform. In case you want to present, or you are a company that wants to sponsor this webinar series, you can contact us on info@africaresp.org, info@africaresp.org. Or when you go to the website, the information or the contact information there, you can reach us over there. And as I said earlier, the webinar series is brought to us by Zopec Medical. Zopec Medical produces the world's smallest and efficient batteries that is portable and supports our medical equipment in helping patients with mobility, or maybe transporting a patient from one unit to another without any interruption in power supply. Now, for those in Africa, there's a country representative for Zopec, and the number is +27662332941. You can email at jtoboys@pomair.co.za or www.pomair.co.za. Or you can contact the Africa Respiratory Care at info@africaresp.org, or there are contact information that if you want to reach us, we have +233-549-239673. You can contact us on WhatsApp, or you can call or WhatsApp also on +147-357-3590, or visit the Africa Respiratory Care Association website.